a graph line, right? And this is where your, when you're compressing, this is the circulation. The moment you stop to even give breath, it comes down. And then we are restarting back again. So the more interruptions you have, the more chances of the spontaneous circulation to return is decreasing. So your interruptions can never ever be more than 10 seconds. So the only time of interruptions are allowed are when you are shocking the patient with the AED, when you are checking pulse, okay, when you are assessing his breathing, and when you are giving the breath. At no other point of time are interruptions allowed. You can't just be like, I'm going to adjust my watch now, I'm going to talk to someone and stop this. You're not going to even stop when the doctors come and, history, all that is not allowed. Right? So when someone else takes over, then you stop and then you give the doctors the history or the paramedics the history and whatever is required. Never stop in between because it's just going to make things harder. Right? It is going to make it very difficult for the life to come back. So this is what we are doing. So I already mentioned. So you are putting the heel, and this is how we are performing by interlocking. 1, 2, 3, 4, 5, like that. Okay. See how he has just kept the heel, right? You can see, right? Just the heel. So not the whole palm and press. Because you're not going to get enough force if you put the whole palm. Because the entire force now is being distributed over a larger surface area, right? So now this one is just a little surface area. So now we get more force transmitted. Okay. So push hard and push fast. So doing all this is not gonna happen. So push hard, push fast. Allow complete chest recoil. So we are not going to just push like this because the chest is not coming back up. So what are we achieving? The heart is not filling with blood. We are just compressing something and it just keeps on getting compressed. It's not coming back to its original form. So that is not going to help, right? So we have to allow complete chest recoil. But don't go do like 1, allow complete chest recoil, 2. That is not required. 1, 2, 3, 4. Okay? Like that. So depth of compression, okay. For you guys it might be a little difficult, to figure out what's 2 inches or, 5 to 6. But mostly, for most people, just make sure you're pushing hard, you're pushing fast, okay? So like this, you just have to keep pushing. And as you rightly mentioned, 100 to 120. Okay, what's that? See, now this is the C spine, right? I was mentioning. So I think all of you can feel if you feel it down your neck, can you feel a slight bulge? You can feel it, right? So that's the spine of C7, okay? So what happens is, if you suspect any kind of injury to the neck, do not move. Because the spinal cord is traveling, okay, we do not want to damage it, we do not want to paralyze the patient in our effort to save it. Okay, quality life is just as important as having the life itself. So now, okay, if the patient is just like this, right, you are not just going to keep the breath like that. Because the breath is not going to flow correct. So we have to make sure we are keeping the breath in a way that it actually reaches the lungs. We have to make sure we lift his head. Okay, lifting his head, right? And we are pulling the jaw up. Okay? Are you guys getting it? Okay. Patient is lying like this. Making sure we tilt the head front like this. A yes and no would be very helpful. Okay. And we are giving a sort of a lift. Okay? Are you guys getting it? So from the side if I am doing it, I am just making sure. Imagine both hands are there. I am showing with one. I am tilting the head and I am lifting the jaw. I am lifting the jaw like this. Tilting the head. Here the jaw is not lifting, this is rigid manner. So I am lifting the jaw. Okay. So tilting the head, lifting the jaw like that. Come like that. Okay. If the C spine now that injury is there, that neck has been injured, you can clearly see it was not wearing a helmet or it fell from a height or something like that has happened. You can, okay, these are the scenarios. If you can't see an injury, there's very high chance, okay. Am I being boring? Okay, so okay, so then don't go lifting. Yeah, you're gonna with this thing only this is movement, but in a patient the whole thing is gonna move, right? So you just make sure you just give a jog. You're just lifting the jaw like that. Just like that. Don't go moving the neck. You're going to paralyze. Okay. This breathing, no? If you think the patient maybe has some sort of infection, if you ever come across that, do not give the breathing, just the compression is all good. Okay, you can just continue the compression. If the victim you feel doesn't have some sort of infection or some sort of disease that can be communicable, that can spread to you, you are allowed to give it. So we have the thing called pocket mask. A pocket mask, well this is the mask you see it in the hospital where we'll place it like that and we'll placing it with the ambu bag, right? You have seen that they'll compress the bag, right? So this one will be used in the hospital, but a pocket mask, right, has a one-way valve. Just like how the heart of the valve doesn't allow backflow, right? That also would have a valve. So once you're giving your breath through it, your breath reaches the victim. But the victim's anything doesn't come back to you. But at most times, none of us are carrying a pocket mask with us, right? So what do? You can take a handkerchief or tissue or a piece of cloth, place it on the mouth, right? Pinch the victim's nose. Okay, you are still doing this maneuver. You are still, lifting the head. You are doing the jaw thrust. You are pinching the victim's nose. This is already placed, and you go make a tight seal of your mouth against his, and you give the CPR. Okay, and you keep the breath. Only 2 breaths. Okay, so we have performed 30 compressions now. Okay, and now we are giving 2 breaths. So 30 is to 2. Now let's say someone else has come. Okay, now let's say I am doing and you have come. Okay, so I am continuing the chest compressions. I will tell you to take over the airway. You can do the same. Lift his head, do the jaw thrust. Make sure you are pinching the victim's nose, putting the cloth or whatever, and you start giving the breaths. So long deep breath, deliver it over 1 second. Okay, not very shallow breaths. That is not going to help, right? So you're going to give the breath. 2 breaths. So common misconception is our breath, exhale breath contains carbon dioxide. What is the point, right? But how much oxygen is in the air? 21. How much is in the exhale breath? 60. Yeah. So it's about that, right? So there is enough oxygen in our exhale breath to actually revive the victim. Okay. So we'll give it 2 times. Now, as I was mentioning, 2 people have come. Okay, if you are doing it alone also, you have to do decompression and 2 breaths. Now, if 2 people have come, the one thing you can do is you can just keep switching. So now you have come and you are giving air and I am taking care of chest compressions. And when I am 48, you have 2 breaths. You have to keep your arms. Yeah, that's right. Yeah. Again, it's very good. Okay. Okay, take it closer. But you are tall also. Very good.